Welcome to the June issue of the Journal of Vascular Surgery. We have 4 outstanding papers to tell you about today, and many others that you should read in this month's journal. The first paper, by Wang and colleagues from the University of Pennsylvania, examined national trends in the treatment of thoracic aortic aneurysms and type B aortic dissections using the national inpatient sample. Between 2000 and 2012, 155,000 patients were admitted for the combination of both diseases, with aneurysms being the more commonly treated. The authors found that endovascular repair had supplanted open repair as the most common procedure for thoracic aneurysms, following FDA approval of endovascular devices. For dissection, thoracic aneurysm repair was also predominantly endovascular. The mortality associated with the repair of both diseases has progressively diminished, presumably due to the increased use of endovascular repair for aortic aneurysms and descending thoracic aortic dissection. The next paper, our editor's choice, is Tissue Expanders Stimulated Lengthening of Arteries in the Treatment of Middle Aortic Syndrome in Children, by Kim and co-authors from Boston Children's Hospital. He reports on a new innovative approach to an all-autogenous aortic reconstruction for middle aortic syndrome, using 3 stages, one for abdominal celiotomy, an implantation of a retroaortic expander, a second stage 2 for ultrasound-guided tissue expander filling, often under using general anesthesia, followed by stage 3 in which the stenotic aortic is resected, the aortic reanastomosed end-to-end, and the visceral vessels reimplanted into the aortic wall. 4 of 5 patients who underwent this procedure had successful completion of all 3 stages, and the 4th required a prosthetic graft. All aortas and vessels were patent at a mean of 3.2 years, and postoperative patients were doing well, and blood pressure was well controlled. This innovative approach to middle aortic syndrome, when technically feasible, may become the standard of care for this disease. The next paper, by Sokal and co-authors from Dartmouth, examined the national trends in aortic aneurysm repair from 2003 to 2013. The authors noted an overall reduction in the total number of aortic aneurysm repairs of 26%, with a marked reduction in open repairs of 76%, while endovascular repairs increased from 11 to 16,000 over the same 10-year period. Branched and fenestrated endografts also increased dramatically from 2011 to 2013. Since the number of open repairs decreased by 80% over the 10 years, the authors questioned whether open aneurysm repair should remain as an index of quality and whether vascular surgeons have adequate volume to maintain their open surgical skills. The final paper, Long-Term Outcome of Endovascular Popliteal Artery Aneurysm Repair, by Goldshare and colleagues from the Netherlands, examined the longer-term outcomes after endovascular popliteal aneurysm repair with a stent graft. Unilateral artery aneurysms were repaired in 60%, and it was bilateral in 17%. The primary patency at 5 and 10 years was 60 and 50% respectively, and stent fractures occurred in 30%. 1/3 were associated with graft occlusion, which presented primarily with claudication. There were no amputations, and the survival at 10 and 5 years was 78 and 40% respectively. This study shows an adequate long-term patency and low risk of amputation with stent graft repair of popliteal aneurysms. We encourage you to read each of these papers as well as the other outstanding papers in the June issue of the Journal of Vascular Surgery. And thanks very much for listening to this presentation.